Hello, my name is Dr. Ronnie Bell, and I'm the chair of the Division of Pharmaceutical Outcomes and Policy here at the Eshelman School of Pharmacy. And today we have one of our amazing doctoral students, Soroush Fariman. So hello, Soroush, good to see you.
Thank you, Ronnie, for the introduction. Good to see you as well.
Yeah, so tell us a little bit about yourself. So what are your research interests and your future career goals?
So I'm a pharmacist by training and now a PhD candidate at Pharmaceutical Outcomes and Policy. My research focuses on the oncology care delivery, and I'm interested in learning how we can optimize care for patients with cancer and how to improve their outcomes. Also of importance to me is understanding how the health disparities affecting the historically marginalized populations and how we can intervene on the root causes to remediate them. What do I want to do for my career? I see myself in a research career that focuses on bridging the gap between what we know that works and the type of care that patients actually receive in the real world.
Great. So we're here today to talk about a paper that you recently had published in the American Journal of Hospice and Palliative Medicine. So congratulations.
Thank you.
So your paper was a scoping review entitled End-of-Life and Palliative Care Disparities Among American Indians and Alaska Natives. So tell us a little bit about this work. So what led you to do this work?
Well, this work stemmed from a recognition that American Indian and Alaska Natives with cancer experience some of the most profound disparities. And we wanted to understand what are the disparities in the context of end-of-life care for the patients with cancer. So, and the literature on this is so sparse and so underdeveloped, so we decided to take one step back and systematically map what we know around the quality of end-of-life care that American Indian and Alaska Native patients with cancer receive. So we did this, which led us to do the scoping review. Especially important to me was to do this and to discuss the disparities in the specific cultural, systemic, and policy context for the indigenous communities.
Okay, great. And so what did you find? So what did the literature, what are some of the key points that you found in the literature?
The literature on this is very heterogeneous in methodology and at the type of outcomes that define the quality of end-of-life care. What we found was that the majority of the evidence out there shows that American Indian and Alaska Native patients with cancer experience a more medicalized end-of-life experience, and that means more likelihood of dying in a medical facility in the hospital, experiencing more emergency care and more hospitalization, more aggressive therapy, and more acute care needs as they approach the end-of-life period. And the discussion around what contributes to these disparities usually focuses on two main contributing factors. One of them is the geographical access barriers, because we know that a majority of this population might live in rural areas or in reservation-based communities. And the other important factor that often appears is the cultural communication barriers when it comes to the patient providers discussing what patient preferences are for the end-of-life care, and the presumptions that that many clinicians may have about these discussions with patients who are American Indian or Alaska Natives, and just how we need to be improving on the cultural safety of our end-of-life care services.
Okay, great. And so were there any strengths or limitations of the work that you did?
So I think the strength was that we did it very systematically, and we tried to be informed by theory and look at the multi-level systemic, cultural, and policy level barriers that shape the end-of-life care experiences for the American Indian and Alaska Native patients with cancer. And we gathered all the published evidence around this to date.
Right.
The limitation, I think the most obvious one, is that American Indian and Alaska Native patients are often underrepresented in the data sets.
Right.
And they often get aggregated with the other race category, in that we lose so much insight that could inform care and policy for these patient populations. we also don't have enough community integrated research to inform the heterogeneity that includes in this population. We say American Indian, Alaska Native. We put it as a label, and it includes hundreds and hundreds of different tribes with different cultural, geographic, and lived experiences. And we just don't know much about. There's so much to unpack there. We don't know much about the end-of-life care preferences, the priorities, the care gaps that each of these communities face.
Right. So what recommendations would you have for future research in this area?
So I think it's important to keep doing this research because we just don't know much about the heterogeneities that include that exist in this population, again, in this big label, and how it's important to improve the research infrastructure in partnership with the communities, with the tribal organizations to get to know how we can make our palliative care and end-of-life care services more culturally safe for these patients and communities. The other important research direction is understanding how we can develop the intervention to remediate these disparities. And again, this gets to the two factors that we previously discussed, which is the geographic access and then the cultural communication barriers. So designing interventions that focus on bridging the gaps by intervening on these two main barriers to access to proper end-of-life care for this patient population should be the priority.
Okay. Yeah, great. So who worked with you on this project?
Well, I did this project as part of my broader doctoral research training at DPOP. And Joel Bigay, a friend and colleague of mine, who's a PhD student at the epidemiology in Gillings, helped all along the way. Doctors Stephanie Wheeler and Mark Emerson from Gillings also helped a lot. And then Dr. Linda Baran-Stepanov from the Cancer Care Initiatives in Colorado helped so much with shaping how we interpret the findings and identify the gaps in future priorities. Jennifer Elson-Lafada from DPOP and then you from DPOP, who you mentored this project all along the way, and I'm very grateful to you for that.
Yes, well, it's an exciting project. Congratulations again, and I believe you presented this work at a national conference last year.
So yes, this work was presented in the American Society of Preventive Oncology annual meeting in 2024 in Philadelphia, and it was received very well by some of people who were actually involved with the tribal organization or with the health system who had a lot of American Indian and Alaska Native patients, and it resonated with them about proving the palliative care and end-of-life care services that they want to deliver to these patients. So I was very happy with that.
Great. Well, thank you for your time and congratulations again.